Good evening. I'm psychiatrist Jay Fawver, and welcome to Matters of the Mind. Matters of the Mind is a weekly mental health program where you get to choose the topic for discussion. So if you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And if you're able to do so, you may call or text me during this program. And I'll start tonight's program with a text from Pat from Fort Wayne. Pat, you had asked, what can be taken if a person seems to get stomach and other side effects from most medications they have been put on? I've have been sick for over a week and drained, and also can Claritin cause anxiety and headaches? And I'll start with Claritin. Claritin is an antihistamine medication that only about 20% of it gets into the brain. So you get this blood-brain barrier here. It's kind of like a screen, a mesh screen all over the brain. And Claritin, about 20% gets into the brain, as opposed to something like Benadryl, where 50% gets into the brain. So Claritin doesn't usually cause headaches or anxiety after you take it, but as I always tell people, if something has a 1 out of 1,000 chance of causing a side effect, and you're the one person, hey, you're the one person. So if you noticed having more anxiety and more headaches after starting Claritin 2 weeks ago, 1 month ago, whenever, okay, you might be able to stop the Claritin at this point and see how you do. It should take about a week for it to wash out. Talk it over with your primary care clinician. So that's a Claritin question. How about nausea and just feeling sickly? Again, you're going to be talking to your primary care clinician about that, because number one, you want to go step by step in determining which medications were started when, what kind of side effects you had. Now, I'm a psychiatrist, so I imagine you're asking me about medications used in psychiatry, such as antidepressants. Antidepressant medications, especially if they affect serotonin, can give you some nausea the first week or two of taking them. And not uncommonly, we'll hear about that because serotonin medications can stimulate a particular serotonin receptor called serotonin receptor type 3. There's 14 different serotonin receptors. They're identified by letters and numbers. In the case of serotonin receptor type 3, it only has a 3. So if you stimulate serotonin receptors type 3, it can cause you to have nausea. And what we do is we'll block serotonin receptor type 3 with another medication like mirtazapine or Remeron. Sometimes we'll use a very specific medication like ondansetron, also known as Zofran, to block serotonin 3 receptors. So one option will be, if you have nausea, you can take a medication to mitigate or relieve the nausea over the course of a couple weeks, and hopefully the nausea from the antidepressant would go away. Secondly, you could always adjust the dosage. Many times we'll tell people to take the medication with food. Now, it might sound weird that you're taking medications with food if the medication is causing you nausea, but if you take medication with food, it will slow the absorption of medication and give you a lower peak blood level of it. And if you have a lower peak blood level of a medication, often that will give you fewer side effects. So, for instance, many people will take certain medications with a fatty food, such as peanut butter, avocado, egg, and if they take the medication with a fatty meal, it'll decrease the peak blood level of the medication and give you fewer side effects. So from what you're describing, I'd talk it over with your primary care clinician. Try to document, before you see your primary care clinician, document what the side effects are, when they seem to have began, and what medication changes were made during that time. As clinicians, we try to track that the best we can in our fancy electronic medical record systems that we have nowadays, but we need your help to be able to do that. If you can document and try to track day by day how you felt and when the medication changes occur, that really helps out. Thanks for your text. Let's go to our first email for tonight. Our first email reads, Dear Dr. Fawver, I believe I have ADHD. Now, I'm going to say right off the bat here, that might be alcohol use disorder with ADHD. I'm not really sure what ADHD, or you might be saying ADHD. So I'm going to address this particular email as if it's ADHD, and I'll mention alcohol along with it. Okay, not much information on ADHD or ADHD. My doctor wants me to take Zoloft and Adderall. What do you think? My daughter took a patch medication for ADHD. I'm going to think you're saying here she developed Tourette syndrome at 13 years of age after taking it for 2 weeks, the patch medication. The patch medication for ADHD would have been a stimulant medication, so that's a possibility. Daytrana is an example of that type of medication. It's a slow-release methylphenidate or Ritalin patch. So, okay, you're describing ADHD, maybe you're describing alcohol use disorder with that. And I just want to point out, when many people have ADHD, they have trouble with impulsivity, they have racing thoughts, they have distractibility, and they're trying to calm down somehow, some way, so they might use alcohol as a means of decreasing those symptoms. Not a good way of self-medicating, but that's what a lot of people do. But ADHD, Zoloft is an antidepressant medication that can also be helpful for anxiety. So your clinician may be diagnosing you with some anxiety, maybe some depression. That's where the Zoloft comes in. Zoloft will increase serotonin throughout the brain and hit all 14 different serotonin receptors and hopefully help with anxiety and possibly depression. The Adderall medication itself is something that I'd certainly recommend if you take it, take an extended release formulation. The immediate release formulations of Adderall, and that's 4 amphetamine salts in Adderall, the immediate release formulation will get in your system really fast, but it gets out of your system really fast too, after about 3 or 4 hours. So people on Adderall, immediate release will get this on-off effect. It's an up and down effect. At best, Adderall XR might last about 8 hours because XR is a capsule formulation where there's little beads, and half the beads will release right away. The other half of the beads release 4 hours later. Adderall XR is preferred over Adderall itself, but even more so, there's long-acting formulations of the amphetamine class, just such as Mydayis and Vyvanse. We prefer those because you want a smoother, longer effect overall. But ADHD treatment is very much like getting fitted for eyeglasses. If you need eyeglasses, you get the right lens strength on eyeglasses, you can see much better and you can see very clearly. With ADHD treatment, it's the same. If you have ADHD where you need a stimulant medication, stimulant medications for ADHD are over 90% effective. They're extremely effective for most people. So if you have ADHD, they can help you, but you got to get the right dosage and the right formulation of medication. The dosage not being too high, not being too low, and the formulation being a slow release, long-acting type of formulation. Now, you had mentioned either your daughter or yourself developed Tourette's or twitching after receiving a stimulant medication at the age of 13 years old. That can be true because a stimulant medication increases dopamine. If you increase dopamine, you can get more twitchy. And the Tourette's symptoms can be aggravated by that if you have an underlying propensity to having Tourette's. Thanks for your email. Let's go to our next caller. Hello, Ruby. Welcome to Matters of the Mind. Ruby, you want to know about religion and spirituality. Can they improve mental health outcomes? Well, religion and spirituality are a little bit different, Ruby, so I'll also differentiate those right off the bat. Spirituality is something where you're considering your existential purpose in this universe. In other words, why are you here, all right? Spirituality does not have to include religion. Religion doesn't have to include spirituality. They're different phenomena. So spirituality is where you are seeking meaningful, purposeful activity in your day-to-day life. You're trying to find some meaning in your life, and often that is through a connection with the divine spirits. So you're looking for connection with God. That's spirituality. Now, religion is a means by which you can basically worship as a part of your faith. And it might include spirituality, but you're worshiping as part of your faith, and you're worshiping by different texts that you might read. You're worshiping based on community support. You're in small groups with people. You're going to outings and functions. It's much more socially connected when you're talking about religion. Now, the thing about religion laws and ceremonies are often strongly influenced by man. Now, they should be connected to God and maintain God's overlying purpose, but the rituals and the laws and various religions are often created by man himself, so you have to be aware of that. Spirituality, on one hand, gives you meaning and purpose. Many people who have a greater spirituality will find that they can cope quite nicely with long-term chronic illnesses and even end-of-life issues. So having a higher spirituality can improve your outcomes with end-of-life issues and chronic medical conditions. There's been studies showing that if you're active in a church or a synagogue or some kind of religion, if you're active in that religion, you tend to have better medical outcomes overall. And we're talking about fewer symptoms, we're talking about greater length of life. If you're involved in a religious community, which includes the social network that the religious community brings, you can often have better mental health outcomes. And quite frankly, as a psychiatrist for the past 40 years, I have found that for many people, it's their spirituality that will get them through a crisis, because greater spirituality, where you're trying to establish some meaning and purpose and having that connectedness with God, greater spirituality will give you greater resilience. You can put up with stuff better. You have better coping mechanisms. And quite frankly, some people who have been on the verge of suicide, the only thing that kept them from dying from suicide would be their relationship with God. They didn't want to make God angry with them by ending their lives prematurely on their own hands. So spirituality, religion do have meanings, and they have a role in our treatment and from a psychiatric standpoint. And over the course of time, I think we will and should ask more questions about spirituality. There's a questionnaire called the Duke Religious Experience Index. It's 5 questions. It's copyrighted by Duke, but they allow anybody to use it. But it's basically 5 questions looking at your spirituality and religious faith, looking numerically, gives you a numerical outcome on what degree of spirituality and religious affiliation you might have, and how big of an impact that will be in your life. I think it's very important to examine that for many, many people to try to help them with any mental health outcomes. Thanks for your email. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, does N-acetylcysteine lower glutamate in the brain? Simple answer there is no. But NAC is N-acetylcysteine. N-acetylcysteine is the precursor or building block to glutathione. Glutathione is kind of like the handyman in your brain, all right? Glutathione just cleans up messes. So glutathione is very important, and NAC is a building block for glutathione. Glutathione is thought to be a free radical scavenger, so bottom line is it cleans up a bunch of messes in the brain. When you take NAC, theoretically, you can get decreased inflammation in the brain. 600 milligrams twice a day is a common dosage. Talk it over with your clinician if you're thinking about using NAC, because if you have a sulfa allergy, NAC can be problematic because NAC is chemically related to a sulfa, so you can't take it with a sulfa allergy. NAC has not only a role in helping produce glutathione as the handyman, it not only has a role in helping with inflammation, which occurs in the brain not uncommonly when people have depression, but it also has a role in stabilizing glutamate. So it doesn't decrease glutamate, it keeps the right amount of glutamate in the synapse between the individual neurons, and in doing so, when something stressful occurs, you don't get a blast of glutamate, you don't get an excessive outflow of glutamate. So what you want is you want to be able to deal with stressful situations and changes in your lives without getting that blast of glutamate. Glutamate is the excitatory neurotransmitter in the brain, GABA's the brake. Glutamate's like the accelerator, GABA's the brake, and it's kind of a nice balance like a teeter-totter. If you get too much glutamate, you can get irritable, angry, you could even get psychotic and have seizures. If you get too little glutamate, you don't have any motivation, you can't think, you can't concentrate, and you can't do stuff. So you want the right amount of glutamate. So think of glutamate in the synapse as kind of like being the right temperature in your house. You want your temperature in the house to be 68, 70, 72 degrees. You want it right about that same level. You don't want your house to get too warm or too cool. In the same way, in the synapse itself, in between the neurons, you want the right amount of glutamate. NAC helps you maintain the right amount of glutamate. So we will use NAC, 600 milligrams twice a day, as an add-on medication for antidepressant medications, for mood stabilizers, just to try to help them work a little bit better. And you might have heard a little bit about NAC during the COVID pandemic, where people would have a respiratory infection and they would take NAC 600 milligrams twice a day, sometimes 1,000 milligrams twice a day, as a means of helping them with respiratory distress where they had trouble breathing. So NAC could actually help them breathe, probably from an anti-inflammatory effect. I was a pharmacist before I went to medical school. My goodness, way back in the 1970s, when I was a pharmacist, we used NAC all the time for people who had Tylenol overdoses. So that's something where NAC was originally used, for Tylenol overdoses. So people would overdose on Tylenol in a very impulsive manner, thinking it was relatively safe to do so, and they could have a destruction of their liver. If you give them NAC quickly enough, you can reverse the damage from the Tylenol on the liver. So that's NAC has been used for a lot of different things, but it stabilizes glutamate. It keeps the glutamate in the synapse at the right level, but it does not decrease synaptic glutamate. Thanks for your text. Let's go to our next caller. Hello, Pete. Welcome to Matters of Mind. Pete, you want to know, how would you convince your friend of your truths? your friend doesn't seem to understand your logic, and you both end up getting really upset with each other. Well, when we talk about truths, Pete, you're talking more about an opinion, all right? A truth is like a law of gravity. It's something that's constant from a physical standpoint. A truth is what it is. A truth is like a speed of light. You don't have your own truth for the speed of light. You don't have your own truth for the law of gravity. You know, the truth is what it is. So you're describing more of an opinion. So when we talk about our perception of reality, of stuff happening around us, all right, as we all look around us, we have perceptions of the reality. Initially, just looking at the spectrum of our perceptions of reality, number one, you can have a gut feeling about something. That's kind of the lower part of the spectrum. So you can notice something happens, get a little bit of a feeling about it, pass it off, don't think about it so much. Secondly, in terms of the perception of reality, you can have an opinion. An opinion is where, based on your life circumstances, based on your past experiences, you form an opinion on something. And that might be different from somebody else. That's okay. It's okay to discuss opinions, and I think you're discussing an opinion with your friend. When you discuss opinions, feel free to understand the other person might have another opinion. When you're raising your voice, when you're calling each other names, when you're trying to shout each other down, and worse yet, when you're threatened with physical violence because you have a different opinion, okay, that's when you realize that you're not really having success in conveying your logic with your opinion. So have a back and forth there about the opinion. That's the next level of your perception of reality. Your next perception of reality will be based on your life circumstances, based on who you are as an individual, based on your spiritual, based on your political, based on your interrelational beliefs, based on who you believe you are. There's an established part in your brain called the ventral medial prefrontal cortex. It's right in here. So there's a brain looking at you here. On the inside of that part of your brain, it's the ventral medial prefrontal cortex. It's down here right above this little gray area here, but it's ventral medial because it's on the inside of the brain. So this is the part of the brain that you light up when you're identifying an opinion that comes in or information is coming, and it either jives or doesn't jive with who you are as an individual, your identity and your role in life, so to speak. So we all have this perception of our own identity, and it will influence our opinions and our thoughts. That's the ventral medial prefrontal cortex. And right above that is the dorsal medial prefrontal cortex. This is where your thoughts, your opinions, your perception of reality around you is influenced by who you're around, the social network with whom you're communicating. If your social network strongly believes a certain way, you will often adapt those beliefs because you want to have that sense of belonging and connectedness with your social network. And it's very, very common. People can have pretty strong opinions about something, but then when they're on a strong social network around them and their social network is insisting certain other opinions, their perception of the reality are going a different direction, you can have that confirmational bias that can occur. That is where you'll be leaning one way or another based on how other people around you, who are important to you, how they are believing. So it's influenced by the dorsolateral prefrontal cortex. It's an interesting phenomenon. When a woman delivers a baby, all right, and she gets postpartum depression, typically within that first month after delivering a baby, and it can go on for the next year. But when a woman delivers a baby and has postpartum depression, the dorsal medial prefrontal cortex shuts down. In other words, she doesn't care about her social network, and she doesn't care about her baby so much. It's a horrible thing to see, and that's why we need to treat postpartum depression very aggressively when we see it. But when a woman has postpartum depression, she just doesn't care about the bonding, the social networking at all. And it's because this dorsal medial prefrontal cortex just isn't working. So these different levels of the perception of reality can begin with a gut feeling, an opinion, your identity of your own ideology of who you are, and also your social network. And finally, as we go up to another level, what's the eventual truth? There is a truth. That's like I said, there's a law of gravity. There's a speed of light. If we look at my cup right here, this is a cup. It's a ceramic cup. It's something that has a beverage in it. And you can look at that cup and say, you know, my truth is, my reality is, I think that's a softball. Okay, if it's a softball, it's kind of shaped like a softball. It is white like a softball. So it has some characteristics that's kind of like a softball, But if I threw it, it would crash if it hit the ground. It wouldn't throw like a softball. So realistically, the reality is, the truth is, even though your opinion might be, it kind of looks like a softball. It has some traits of a softball. It's not a softball. Now you can crush it, you can destroy it, and try to mold something like a softball into it, but it's still originated with its purpose of a cup to hold beverages. I also think of the molecular structure of water. Most people know that, H2O, hydrogen and two oxygens, or two hydrogens and one oxygen. So H2O is a molecular structure that is very fixed. Now, when it's at room temperature, it's in the form of wet water, but when you heat it up, H2O with the two hydrogens and one oxygen becomes steam. When you make it really cold, it becomes ice. It's still H2O, changing its structure, changing its form based on the environment itself. We do the same thing as people. Our opinions might change based on who we're around, and we can be highly influenced, but it doesn't change the actual truth of what's happening around you. So the truth can be something that we should explore, and we should be very conscientious in seeking, because we want to know, by asking question after question after question, what really is true, as opposed to what's somebody's strong opinion. One thing that we saw during the COVID pandemic over the course of a couple of years, it was a very interesting social experiment in many ways, but one thing that I noticed was as you watch the media, a lot of scientists who were experts on COVID were insisting that their opinion, which they called it was the truth, was accurate. Now, as scientists, we should always be asking more and more questions. And even as a clinician, if I'm making recommendations to patients, patients are welcome to explore the internet sites that hopefully are going to be fairly credible, where they can explore if what I'm recommending is going to be helpful and what really is true and what can't be. We try to do the best we can to gather information as we can find it and try to give accurate diagnoses and appropriate treatments based on those diagnoses. But as a patient, you're in a role now, especially with this vast opportunity to explore the internet and explore various ideas out there, that you can try to understand what might be best for you individually. So, when I hear a scientist say, well, my truth is accurate because I'm a scientist and I'm this person, or I have all these degrees behind my name, doesn't mean we can't question that person. And when a person gets more upset with you because your opinions don't align with theirs, and they're getting louder, and they might get threatening, and they call you names and all these different, that person you don't want to interact with, because obviously they're upset because they can't convince you of the reality as they see it. It might not be the truth, but it's not the reality as they see it. There are some cultures where school kids are not encouraged to ask the teacher questions, because asking the teacher questions would be thought to be disrespectful. I can't disagree with that more. When you're in school, you should ask questions in a respectful manner, and you should be very tactful on how you ask the questions. Some questions can be asked in the classroom. Some questions should be asked realistically after the classroom when the class is cleared out some. But I encourage kids in school, whether it's high school, college especially, ask questions, because you don't want to just have blind indoctrination with certain ideas without asking questions. How did you come up with that idea? What kind of resources are you using? What's the history behind your thoughts? Ask questions, ask questions, ask questions. It's some of the best way that we can gain more information. Long answer, but thanks for the email. Let's go to our next email. Our next email reads, Dear Dr. Fawver, can postpartum depression or psychosis begin as a mother with suicidal thoughts for the first time in her life with no prior mental illness? The answer there, by the way, is yes. I then developed an intense fear of me hurting the baby, and I also felt suicidal times, and I have a fear of men hurting my child. Can this be treated holistically? Well, there's several different questions there. Number one, if you have postpartum depression, you can indeed have that progress to postpartum psychosis, where you're out of touch with reality, and along with that, you can have fears of harming the baby. Now, the good news is the fear of harming the baby usually isn't an intense enough thought to lead to intention to harm the baby. If you have a fear of harming the baby, you at least have the ability to hold back those impulses. The women who fear their babies will often get psychotic where they've lost touch with reality. It happens in about 1 out of 10,000 births, but these women lose touch with reality. They have the intention to hurt their baby, and they often do because they perceive their baby as an evil object of some type, or there's a reason behind it. Having a fear of hurting your baby is more of an obsession. An obsessive compulsive condition is kind of like the mother-bear effect, where you become very conscientious about the safety of your baby, including the fear that you might hurt your baby, and along with that, as you mentioned, the fear of men hurting your baby. If you have OCD following delivery, and if you have postpartum depression or postpartum psychosis, I would certainly treat that very seriously. If you had a myocardial infarction and you had a heart attack, you might say, oh, gee, can I just treat this holistically? No, you don't want to. You want to take it seriously. I would take postpartum depression, especially postpartum psychosis, obsessive compulsive disorder about fearing that you're going to hurt your baby. I take that very seriously and make sure that clinicians are able to treat you accordingly, because a lot of this is simply a hormonal change that can be addressed. We have medications now and various treatments that can address the hormonal change after you deliver a baby. And yes, you can get depression for the first time ever after delivering a baby. Thanks for your email. Unfortunately, I'm out of time for this evening. If you have any questions that I can't answer on the air concerning mental health issues, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne is made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.